Hi, my name is Amanda Dixon, and today I will be discussing case study number 4, Strategic Information System Planning for the Hospital ED. Newcastle Hospital serves over 200,000 patients. The hospital is located in Newcastle County, New York. Newcastle is a 375-bed community hospital. The hospital is a not-for-profit community hospital. Newcastle was established in 1900. The hospital provides services for residents of Newcastle County. They offer a full range of services for primary, secondary, medical, and surgical needs. The hospital has an independent governing body. It has 25 trustees, 604 active physicians, and 1,121 full-time equivalent staff. The emergency room was considered the backbone of Newcastle Hospital. Currently, the hospital room sees 34,000 patients, and 24 patients of them are admitted, representing 51% of all inpatient admissions. The emergency room is a 2-level trauma center with a great outcome with regional, state, and national benchmarks. The emergency room has an ill-defined manual process and no information. The current challenge is finding an information system that emphasizes informing, not just automating key ED process, supporting overall strategic initiatives of the organization. Newcastle Emergency Room has no structure. The goal of our information system is to provide better service for patients. An information system helps with workflow, supports patient data, and information system allows patients and physicians to better understand the medical history. The emergency room department is missing case management, order entry, nursing documentation, and radiology. Software updates were performed over the years. However, system updates were not documented. The information technology department is located 12 miles away, and the information department lacked required training. There are many challenges Newcastle Emergency Department faced. The first and major challenge was there was no information system, ill-defined manual processes. The ED physicians had inflexibility and unwillingness to change. They was not held accountable for their actions. The ED wait time was 6 to 8 hours, and every time the physicians was asked about their performance, they always blamed they were too busy saving lives. The ED physicians did not have any standards to go by. There was an absence of data required to define, measure, and improve ED performance. There was no IT government, and the IT is located 12 miles away from the hospital. In order for Newcastle to thrive, they must fix all their problems. The culture of the emergency department must change. Physicians in the emergency room was unwilling to change and inflexible. The same physician management team was in place since 1987 until 2 years ago, when the new CEO hired a physician management team through a process called RFP. The physicians were not held accountable for their actions. Serious problems in the ED were often masked or dismissed as anecdotes, even in the face of regular citations and 6 to 8 hour wait times. When a patient comes into Newcastle Emergency Room, they should be checked in and triaged within 10 to 15 minutes. The triage nurse will rank the seriousness of the patient with one being a resuscitation. 2 is emergent, 3 is urgent, 4 is non-urgent, and 5 is a referred. For example, a person coming into an emergency room having a heart attack. The person is rushed to the back to be seen immediately. However, if a person coming in with an earache, they can wait in a waiting room. until a room becomes available. Strong teamwork must be exhibited throughout the emergency room. Leaders must round the ED together, share common goals, communicate together, prohibit separate communication to physicians and nurses. Communicate to sending all communication as a leadership team. Lastly, recognize staff and providers together. However, the emergency room department patient satisfaction score in the 14th percentile for the PET scanning New York State survey, in the 5th percentile, the national survey. To improve patient satisfaction, hospitals should improve person-patient relationships. The hospital policies affecting patients and the environment in which patients receive care. Newcastle Patient Engagement Department must regularly make rounds around ED to check on patients. In 2 or 3 days, to make a call to the patient, see how the visit went. If the patient had a negative experience, see how it could be improved. Physicians should feel supported in an ED. Engage employees who feel supported by their company provide more robos for customers because they care about customer experience in the same way their company cares about them. The CEO must approve an emergency room manager and a head physician. Together, they will come up with standards and fit with the organization, which is satisfy patients and staff and support the needs. The biggest challenge for Newcastle Hospital is not having an information system in the emergency room. A health information system improves the quality of healthcare delivery, increases patient safety, decreases medical errors, and strengthens the interaction between patients and healthcare providers. Their lack of an information system is a major concern. Having no information system disrupts workflow and do not provide the best care for the community or patients. In order to improve the emergency room, many changes have to be made. An information system must be acquired. To find the right information system for the ED, certain steps have to be followed. First, a committee needs to be formed. The committee will consist of 6 to 10 members from every department, 2 which will be a physician and a doctor and a nurse, because they will be the ones that will be using it the most. Next, the committee needs to select a leader, one with the most background information system. Next, the committee will come together to form objectives. The objectives of Newcastle Hospital is satisfying patients and staff, supporting ourselves, and giving better every day. Next, they will build a consensus, which is a vision of how they want the information system to look and what functions they want the information system to have. Next, they will research vendors. They will pick the top 10 vendors and then narrow their choices down to 3 by demoing the information system and cut in based on the cost and how well it fits with their goals / objectives. Next, the 3 vendors that they like or that they approve of, they request for information, and it will have everything from the cost of the system and what do they expect from the vendor, and they must implement a training process for the whole staff can use it. There are many problems that arise in the medical field. However, it is up to the organization to be able to conquer them. A hospital must be able to function with any problems while also maintaining patient satisfaction fully. Newcastle Hospital faced many challenges. If not fixed, it would have bankrupted the hospital. Having a ill-defined manual process, no information, no IT governance, and inflexibility and unwillingness to change, all of these changes needed to be addressed for the hospital could move forward and be successful.